Back inside the Seattle Convention Center here for the 27th Annual Alzheimer's Association Regional Convention, and I've had a great day thus far, learned so much and gotten so much information. A lot of positive feelings, I think, going on right now. Again, it's a somber issue, certainly for so many folks, but again, the idea here is to try and promote some awareness and try and, again, to promote some prevention in addition to that. Talked with so many people today, and we're going to talk to another folk right now, a person who is involved with the field of scientific research, Professor James Leverenz, is that right?
That's right.
James Leverenz is with the University of Washington. He's a neurologist, has been there for about 20 years now, and is an investigator with our Alzheimer's Research Center. Again, Professor, thanks so much for your time today. Where originally are you from?
I originally am from Seattle area. I grew up here and left for a little bit of training in New York and Chicago, and then came back about 20 years ago and have been here ever since. So I'm a real Northwesterner.
Great, and I think as we learned from Lindsay Beach, who talked to us earlier,
yes,
the Research Center has been in place for about 25 years now,
right.
So you've been there for a bulk of that time.
That's right, right. So I was back east, I was doing my work, and they recruited me to come back, and couldn't pass up the opportunity to come back to Seattle and work in the state of Washington.
Wow, very good. In the field of neurology, what specifically steered you down this path as far as Alzheimer's research? I know you do some other things as well. You were talking to us about your relationship to the Parkinson's research that's going on at the UW Research Center too, but what did get you into the field of Alzheimer's research?
Well, it's a little bit of a long story, but I've always been very interested in the mind and how the brain and the mind work in terms of what happens there and why people have certain symptoms, such as with Alzheimer's or with Parkinson's disease. So I was very interested, and so I knew even going into medical school that I wanted to focus in this area and even do research in the areas related to that. So my work has been with Alzheimer's, with Parkinson's, particularly the cognitive memory problems that Parkinson patients have. And most people call me like a behavioral neurologist, so focused on the behavior and the brain relationships.
I see. Okay, so you deal with one side of the disease, probably at a different stage of its onset, I would imagine, or is it through most of its actual progression?
Right, I go all the way from, in my clinical practice, from diagnosis through managing over time to helping people in the very late stages.
All right. Professor Leverenz, I imagine you have been attending this conference as well in association with your work at the UW for many years,
yes,
too. And over the course of your work with Alzheimer's, what have you seen change inside the field specifically? Anything that you might be able to report to us? It's good. We've heard about how far behind it seems like the funding is for research in this area, but is there some good news coming out as well?
Sure. There's plenty of good news. We continue to have the funded Alzheimer's centers, like our center here in Seattle, that focuses on research in Alzheimer's disease. We continue to do very exciting work. I think the field it's a little bit like cancer research, where we're making progress as time is going along, not as fast as we'd like it to go, and there always are some financial constraints. You know, the government doesn't have insurmountable funds to give to us, but we're plugging along, and we're learning a lot about the disease. I think that's the exciting part. The other, I think, exciting part is we're kind of changing in terms of the drugs we're starting to look at now. Before they were drugs for the symptoms of Alzheimer's, which is important, and we continue to work in that area. But also we're starting to look at drugs that actually we think might affect the disease itself. And so we're really looking to try to hopefully, even in the long run, prevent the disease. Treat people even before they develop the symptoms. So I think the field's a lot different than it was 20 years ago. It may not seem to people like it is, but it really has moved quite a ways. It's an exciting time.
And as we've heard all day today about the field of prevention, that's really where we're at as far as Alzheimer's is concerned. On the home front, you need to be in preventative mode at a pretty early age, too. I would say this should start in your 30s at the very latest, or 40s?
Sure.
Okay.
The earlier the better.
The earlier the better, as we've learned, yeah.
The bad news, I think, is it's all the hard stuff, right? Good diet and exercise, the things that are difficult for all of us to do. But the healthier you can stay in a general way with good exercise, good diet, the more you're able to stave off the effects of Alzheimer's disease.
Yeah, Professor Leverenz, you mentioned good diet, and I think about the chemicals in our foods and how overprocessed they are in this day and age, and can't help but think about that history lesson we got on Alzheimer's, going back to the very first case that was seen in 1906, recognized by Professor Alzheimer. And much like cancer, which I suppose in one form or another has always been around, but really not to the severity we're seeing today, do you feel like it is our society, where it has come industrially speaking over 100 or so years since the disease was first recognized in the early 1900s, that has led to so many cases, or do you feel like maybe it went undiagnosed for many years prior to that?
Good question. I think it's probably, at least in part, it was underdiagnosis, under-recognition. The other thing is it's a very age-related disease, and so the number of people who are in the risk age back in 1900, substantially different than what it is now. So I think, you know, the whole world really is aging. It's really quite remarkable, not just in the United States, but India, China, Brazil, these massive population countries, including the United States. The whole population's getting older, and since age is really the major risk factor, we're seeing more and more cases of Alzheimer's disease and age-related diseases. So. And we're, the estimates now are a tripling or quadrupling of the number of cases within the next 30 to 40 years.
Yeah, as we live longer again,
right.
As Bud Thompson, the advocate that we spoke with a little while ago for the association, said very well, I think, which was the good news is we're living longer, the bad news is we're living longer, and again, those are challenges that are going to be facing us all.
That's right, and we just need to learn how to take care of people better as they get older, as we get older, and again, I think the big area of focus right now is to try to catch people early or even before they develop symptoms. I think that's where our research is really focusing now. And again, it's a very exciting time because it'd be great, much like with colon cancer, intervening long before you develop the symptoms when you know you can have an effect on the disease.
Always difficult to sell a lifestyle change, I know, especially in this country, more than ever before. It seems like our habits are really leading to some ill health, and they seem to all tie right in with Alzheimer's. Again, if you are overweight, your chances double of, again, getting Alzheimer's. If you are obese, they're up by 4 times, as we learned today. Other factors like diabetes are certainly involved, too. So the big challenge from that end of the perspective, I guess, is handled on the front lines, but from the research side of it that you're on the end of, Professor Leverenz, where is the big push going to need to come to get more funding for you and just in general get this going a little bit quicker than it's moving right now?
Well, of course, there's always the political side, which is, I think, people need to call their congressmen, their senators, they have health care people who work on their staffs, and let them know that this is an important issue. It's an important issue in their lives, and so put some political power behind that, and to support groups like the Alzheimer's Association. This is a group that also goes to the government and talks and works with them about how do we do a better job in terms of research, as well as how do we do a job in terms of taking care of people who already have the disease.
Yeah, it's amazing the scope of what good is done by the Alzheimer's Association. We've learned a lot about it today. Not being a for-profit governmental enterprise, for example, it's really incredible what's being done just from a grassroots level. So need to step up the awareness for certain, and again, that includes the research side of the equation, which again, James Leverenz, professor at University of Washington, and their Alzheimer's Research Center is a big part of. Professor, thanks so much for your time. I appreciate it very much. I know it's valuable, but we do thank you, and did want to give out a phone number I know where folks could call in and get some information.
That'd be great. Okay. We have phone number 206-764-2069. This is the Alzheimer's Center at the University of Washington, and we're always looking for people who can help us with our research. And to do good research, we have to have people involved. This is about the human race, and without the people participating, we can't do this work.
All right, so again, if you're at all interested or know someone that is, please get them involved. It's 206-764-2069. Again, that's area code 206-764-2069. And again, Professor James Leverenz, one of our guests here today at the Alzheimer's Association conference here in Seattle. Looking forward to chatting with more folks along the way. Professor, thanks so much for your time.
Thank you so much for having me.